find that our jaw is sliding forward too early. There's a little muscle inside our jaw that helps with that. And now if you feel and poke around down here by your face, that big, thick, meaty muscle right there, that's the master muscle we showed you a picture of before. And that's one of our main clenchers. If you feel and clench your teeth just a little bit, can you feel it pop out into your fingertips? Now, open your jaw when you feel like it's stretched out. Okay, so imagine you have to hold your jaw open for a dental procedure, and the little muscle inside has pulled you all the way forward too early, and that muscle here is getting stretched, and then you have to hold it there while they're pushing, poking, prodding, and pulling. And it makes sense to understand why even people who maybe don't have a jaw problem can have pain, but if you already have a jaw problem, it's going to feel that much worse. So I'm going to talk later about some exercises that help with these two movements, but going back to this idea of the self-care sheet that I had here, these habits that we have throughout the course of the day, chewing gum, clenching our teeth, all of those create overuse of our jaw muscles. In the same way that you can get tendinitis from typing on the keyboard all day long, all of these activities that we do without thinking throughout the course of the day can make our jaw really sore. So dental work is a piece of this that can push us to that point. But an easy way to start addressing the problem of having jaw pain is to try and eliminate some of those extra activities throughout the day that we don't need to do. So if you think about, can you survive if you don't chew gum? Yes. Can you survive if you don't bite your fingernails? Yes. Can you survive if you don't eat? No. So you need to eat. But can you survive if you don't eat popcorn? Or if you don't eat jawbreakers? Yes. So these activities that are considered extra can contribute to jaw overuse. And one of the first places to start is to make sure that you're not clenching your teeth, not biting your fingernails, not chewing gum. Some of the habits, though, happen without us realizing it. Most of us don't go out waking up in the morning deciding, I'm going to clench my teeth all day long today. And we're doing them before we notice it. So he had mentioned the rest position of the jaw. That's when you have the tongue up and those teeth slightly apart. One of the ways that I have my patients work on avoiding jaw pain is by checking in with their jaw throughout the course of the day to see, where's my tongue? Are my teeth together? Like he had you do before, say the letter N, or pluck your tongue. That tongue just flops right up to the top of the roof of the mouth. In addition, though, put your fingertips back up in front of on your cheeks. And you want to check in during the day to see, is it hard or is it soft? A relaxed jaw muscle should feel like bread dough or raw meat or marshmallows, because muscles are basically meat. If it's tense and tight, it will feel bony or frozen, almost like a piece of frozen chicken. So during the day, if your teeth are together, your face is probably pretty hard and maybe sore. You can do some gentle self-massage by saying N, massaging in little circles. Imagine what it would feel like to have bread dough in your face. Then pull your hands gently down the sides of your face. You catch the jawbone a little bit. If your teeth are together, it helps to pull them slightly apart. Go back to saying N, take in a breath. Exhale, blow out that tension, pull your hands down the sides of your face. Do that 2-3 times, as many times as you have time for. It should feel really good. While you're sitting in the waiting room, waiting to go in for a dental procedure, gently massage your jaw, stretch by pulling down the sides of your face. The concept of breathing, if your fight or flight response goes off and you're really agitated and you're taking these shallow breaths, you're probably breathing up here with your neck. That's not going to relax you very much, right? When we talk about abdominal breathing or belly breathing, if you put your hand on your belly, you want to try and inflate like a balloon as you breathe in. Sometimes we have to really make it happen because we have this tendency to suck in like that. So if you have your hands on your belly, breathe into your hands, and then exhale. That helps to calm down the system. It gets the body more ready to release those muscles. So when you're up here, you're massaging, breathe into your belly, exhale. You can take a lot of tension and pain down just by doing that. You can also do a little more advanced stretch to try to get these big guys in the side of the face to relax by propping your jaw open with fingers or knuckles. If you're really struggling and you can't open your jaw, you may want to start just with one finger or one knuckle. And just so you know, all of these are printed on that second sheet here. So the one that we just did with massaging and the tongue is the top one. The next one down is the stretch that I'm talking about. So you can.
And they can do that massage on their temples too.
Oh yeah, yeah. You can go up and you can massage in those circles here because those muscles clench your teeth too. They don't feel quite as hard and meaty as these ones down here, but especially if you have a headache, you want to do some massage up there and then pull your hands down the side of your face. So if you want to start stretching a little bit more to get at the joint, you can prop your jaw open. Everybody start with just one knuckle. You're going to open just enough to slide that knuckle in. Add a little pressure upward like you're supporting on your finger. Let the weight of your head rest on your finger. Do one of those belly breaths and exhale. Let the weight of your jaw fall down with gravity. Breathe in again. Big exhale. Let the weight of your head rest on your finger. Let your jaw fall down with gravity. Now that might be enough to stretch, especially if you're in pain. If you want to stretch open a little bit more, you can add 2 fingertips stacked vertically. Same idea. Go in, exhale, rest on your finger, let your jaw hang with gravity. You don't want to bite, and you don't want to force either. If that's not feeling like it's stretching you too much, you can go up to 2 knuckles. You can tell it starts opening a little bit more, it starts stretching. You want to pick the level of stretching that feels the best at the time, and that might be a little bit different every time you do it. 2 knuckles is our goal. His slide said before 3 fingertips is normal opening, and that's true. Sometimes though, if you try to stretch at 3 fingertips, it's really difficult for your jaw to let go and relax, and it might hurt. So between these different options, you can stretch where it feels the most comfortable. I recommend for my patients to stretch for about 3 to 5 good slow breaths. We used to say 30 seconds or 60 seconds, but I found that people would hold their breath and they would count and they would stop paying attention to their jaw. So they would start actually clenching their teeth on their fingers. So by exhaling 3, 4, 5 good slow breaths, you get a good stretch that actually focuses on the relaxation and leaves you feeling better by the time that you're done. Going back to the self-care sheet that Dr. Schiffman talked about before, that first one, the heat or the cold. If you have a jaw that has gone through something traumatic, a dental procedure that day, maybe you got hit in the face by a baseball or a softball, you definitely want to put some ice on the jaw to make sure that there's no swelling that starts to occur. If you eat something really hard or you have a huge pop and it hurts right away, that's a great time to start out with ice. If you have a muscle that's just hard and tight and feels frozen, it's kind of been maybe developing throughout the course of the day, nothing specific triggered it, that's a better time to choose heat. Think about the frozen meat. If you have frozen chicken in your face, you have to put some heat on in order to increase the blood flow and thaw it out. Sometimes ice just makes us clench a little bit more if we're already tight. So in the jaw, sometimes it's a little more confusing to decide, is it heat or ice? Because most of the time they just say start with ice. But heat can be very relaxing and restful. It thaws out those muscles. On the sheet, it says that you can apply for 15 to 20 minutes, 2 to 4 times a day. And that's a great way to address some of that pain that develops from our activities. When you're going to have a dental visit, I highly recommend to heat before you go in. Again, we don't want frozen chicken in our face if we have to be stretched open for a long period of time. Movement of the jaw we discussed before. Dr. Schiffman mentioned hinging the jaw. It's a very protected range of motion. When we just hinge open and close, we're not getting that sliding. And if you're bone on bone, sliding is going to be like 2 pieces of sandpaper rubbing down, and that deteriorates the bone pretty quickly. So if you're just isolating and hinging your jaw open and closed, it feels pretty good. And if we can train ourselves to chew in that protected range of motion, you have food on both sides of the jaw, you're just hinging in place and not sliding forward, you can actually get a lot of food, even some of the hard and crunchy foods chewed that way. But going back to the movement before, put your fingertips up and feel as you open your jaw. Can you feel it coming forward pretty soon? So if your jaw is sliding forward right away, we have to teach it how to rotate. And the way that we do that is with this exercise. I have people put the tongue on the roof of the mouth, like you're saying the letter N. You will only open and close as far as your tongue lets you go. You want to take away that forward sliding movement underneath your fingertip. Go ahead, put one hand on your chin, the other one right in front of your ear, and very gently, as you drop your jaw open, guide it down and back towards your throat, only as far as your tongue lets you go. And our hope is that we take away that forward movement of the jaw. Can you feel that? Does that make sense? If you have any clicking or popping, that clicking should go away because we're not pushing forward to get underneath that disc that probably slid forward. Make sure as you're dropping it open, you're actually getting some space between your teeth. There you go, good. Does that make sense? By doing this exercise, just hinging it open and closed 6 times, it takes 5 or 6 seconds to do. If you repeat that 6 times throughout the day, after about 2 weeks, the jaw is opening straighter, clicking seems to be softer, and pain is less. Because you have trained your body to stop jutting the jaw forward early. It's relaxing that muscle and it's protecting your jaw with its daily activities. So I have instructions for that exercise written down on the sheet at the bottom. 6 times, open and closing each time you do it. Be really picky about how you're doing it. You do not want to feel any of that movement under your fingertip. That's the one right above it, the rotation exercise. As you're rotating or hinging the jaw open and closed. I tell people do it before and after every meal time, because then your jaw is going to have that muscle memory to chew like that as well. When you're eating, put that food on your back teeth, one on each side at the same time. That's like a target. If you keep your back teeth lined up and you're chewing up and down like you're on a track, you're going to make sure you're hinging your jaw, and eating is going to feel just fine. The next exercise below that, the rhythmic stabilization exercise, we use this for some isometric strengthening. And this is especially helpful if you're preparing yourself for some dental work, because with this exercise we want to train the jaw to stay in place while we withstand some force. So try this, put your tongue on the roof of the mouth like we just did, drop it just a little bit open. Now, keep it in place while you add a little bit of resistance. Actually, let's start from underneath. You're going to push up gently, but don't let your jaw close. You'll feel your jaw meet your finger and hold it open. So you're not going to open and close with this. You're going to drop it open, tongue up, drop it in place, then add your pressure upward like you're trying to close your jaw. Your jaw meets your finger and it holds it there for 6 seconds, 5-6 seconds. And relax. You're not pushing very hard. Imagine you have a raw egg and you're trying to see how hard can you push on the shell before it breaks. You're trying to see how hard can you push on your jaw before it starts to close up again. This should be pain-free. You're trying to teach your jaw how to tolerate force without overworking and triggering those pain responses. So we can also do it pushing open. Same position, tongue up, drop your jaw open, hook your finger over your chin, and pull down like you're trying to open the jaw, but don't let it go anywhere. Your jaw is going to come back and meet your finger, and you want to hold it there for about 5 seconds. And of course, you're breathing while you do this too. There we go. Good. And then relax. Could you feel how your jaw engages just a little bit against your finger when you do that exercise? Okay, now we're going to do it side to side. Tongue up, drop it open again. Lay your finger on the side of your jaw. You're going to add a little bit of finger pressure, but your jaw is going to come back and meet it so it doesn't actually go anywhere. And you hold that for about 5 seconds. Good. And relax. Now, you could tense up your neck and tense up your head and not let your jaw move, but you really want to be picky about making sure that the jaw is working. Now let's do the other side. Tongue up, drop it open just a little bit so you're in your good position. Your finger pushes ever so slightly, your jaw comes back to meet it, you hold it in place for about 5 seconds. Good, looks great. Nobody's jaws are moving, so I like it. Now think about what they do to you during dental work. They're pushing from the side, from the top, from underneath. What you're doing with this exercise is you're essentially training your jaw to tolerate the kinds of forces that are being pushed on during dental work. It's just they're doing it from the inside and you're doing it from the outside. So this is good for any kind of movement, but especially if you have dental work coming up, it's a helpful exercise to use to increase your endurance and to make sure that you're not going to be flared up once you have the dental work. So either heat before you go, or sitting in the waiting room. They have those hand warmers that you can get at sporting goods stores. You just click that, hold that on your jaw 5-10 minutes before they take you back for your procedure. And then when you get back home, even if you feel fine, I always recommend to people to put ice on, just in case. And then if you want to, you can alternate the ice and the heat like it recommends on the sheet. And I brought some examples of some of my favorite ways to heat the jaw. Has anybody seen anything like this before? Sometimes they're sold as rice bags or corn bags. This has some beads in it. When you microwave these, they get a little bit moist. And moist heat is absorbed a lot faster than dry heat. So heating pad is fine. I tell people dry heat is better than no heat at all. But if you have something like this that gets a little moist and then you can wrap it so you got both sides of your jaw covered. You can also use it on your neck because we got a lot of neck pain with jaw pain too. This is called the Bed Buddy. They sell it probably most drugstores, Bed Bath & Beyond, but they have rice bags and corn bags anywhere. This one is sold by a massage therapist that I know, and it has cherry pits inside of it.
Yeah.
But you microwave them for a few minutes, they get nice and warm, and they're soft and flexible. They're great options for heating the jaw. Like I said, heating pad, microwavable hot packs, even just getting a towel hot, microwaving it, just watch it so it doesn't catch on fire. But a little bit of heat goes a really long way. And then for ice, of course, if you don't have an ice pack, you can use frozen vegetables or anything in your freezer.